Hello, this is Dr. Mike Hilton. This is a second video in my video series regarding the United States Olympic Committee and my rotation with the sports medicine division. Quick disclaimer, I just want to make it clear that I don't work for or represent any of the views of the United States Olympic Committee or their sports medicine team or Team USA. I was a volunteer sports medicine provider for 2 weeks there, so it's an important differentiation to make that I don't represent their views, and I don't at all have any kind of legal standing with them. So I want to make that clear. Moving on. I want to start this video series by explaining the foundational principles and organization and structure of what makes the USOC Olympic Training Center unique. One of the things that may be overlooked, because it's not necessarily something that everyone would think about, is the fact that the USOC's sports medicine division's overseen by a chiropractor, Dr. Bill Moreau. He's the medical director for the entire USOC sports medicine division across all of the Olympic training centers. And it's important to understand why that I make that point. Chiropractors, we look at the body holistically, naturally. Our training is to try to intervene with the body when it's starting to show us symptoms and try to get down to the root cause of those symptoms and treat it as naturally, holistically, and non-invasively as we can. And those principles work well with the Olympic model because Olympic athletes really don't want to put anything foreign into their body. In fact, they really can't many of the times because of the doping rules anyway. So they're trying to avoid, intravenous things or medicinal things rather. And surgery, of course, is always last resort. I shouldn't say that. I mean, it's something that it's done only when absolutely necessary to get them back to playing, because the priorities are always return to play, return to training, ASAP. So if that is surgery, so be it. But if you can naturally, conservatively manage them, so their body is healing faster and recovering faster and promoting performance, then that is really the principle of what they're going for. Now, yes, chiropractic is center stage there, but also physical therapy and athletic training. Those are the three major professions that are permanently there as far as like what are the doctors that are working there. The directors are both doctors of physical therapy and doctors of chiropractic medicine, and they have a lot of athletic trainers that work there as well as other PTs and DCs. I was the only chiropractor there when I was rotating. As far as the volunteer rotation went, I was with a athletic trainer out of Chicago and an orthopedic surgeon out of Washington, D.C., and we all brought our own perspective to things, which is really the valuable part of the time there. The USOC OTC Sports Medicine Clinic is extremely integrative, multidisciplinary in its approach, meaning you have the best of all of these disciplines coming together and working together under the same roof, same room. In fact, you don't even really designate yourself as a doctor of whatever, chiropractic or physical therapy or athletic training. I'm just Mike when I'm there. And the athletes walk in and they want to get manipulation or adjustments or soft tissue. Those are the two major things. They walk into the sports med clinic. They need to get evaluated, perhaps. They need to get baseline testing. But they also come in with pain, aches, injuries, and they just want to either get soft tissue work, that is to say muscle work, tendon work, fascial, or they want to get adjusted, or both. Most of the time it's both. So I found myself, I was the rotating chiro, so I was the one doing a lot of the manipulation. So I would see high-level athletes in gymnastics, swimming, shooting, boxing, wrestling, cycling, triathletes, both para and standard Olympic. And it was very fascinating to see the different sports and what they would do on the body. So, after you'd be introduced to the athlete, they would either want soft tissue or manipulation or both, and you'd end up working with them for about 30 to sometimes 60 minutes. And throughout that time, I would be doing my assessments. I would be working on them with their muscle and soft tissue. I would be doing methods like hawk grips, which you do here, cupping, which I'm introducing here, which we'll talk about next time, as well as my just standard chiropractic and other myofascial work that I do already. Then I would move them over to the physical therapy or active care suite, and I would be doing active care and rehab on them. I'm also a certified strength and conditioning specialist, which many of my patients may not know that. So I actually do a lot of rehab, or I have the potential and passion to do that. I don't always have time in our current setup in Brighton, but there I did. So it was really interesting to use and hone in on my skills that I don't always practice every day here. Beyond that, they had a recovery center that was staffed by massage therapists, as well as a sports medicine team, and we would be able to use Normatec compression boots, which are just fantastic at trying to recover faster with your lower or upper extremities. They had game-ready cryotherapy, where you use a machine that pumps cold water through a type of device that either is matching to the anatomical area, the shoulder, the knee, the hip, and it compresses and wraps the ice right around it. It's a great way to apply ice, among other things. So the massage therapist would do recovery massage there as well. So it was organized in that way, where you had the sports medicine high-performance clinic, which is where I was in. Then you had the sports recovery center, which was adjacent to it. Then you had the active care suite, which was also right next to it. And we worked kind of interchangeably between all of that. We would see a number of athletes returning from world or national competitions. Pan Am Games is coming up, so some were preparing for that. The National Figure Skating Championships actually in Detroit next month, so we saw some figure skaters preparing for that. So you had a slew of athletes either returning from everywhere around the world needing care, or you'd have resident athletes training right there in Colorado Springs preparing for their next competition. You would also be flying in athletes from around the country and the world that were coming in for baseline testing. The USA sailing team from Miami were there with their own sports med team. They were doing testing, baseline testing, that is to say, to get a baseline of strength and performance and things like that in order to compare and grow off of future. It's a good way to know, if an injury occurs, compared to the baseline, whether it be a concussion or some other type of injury physiologically. So that was happening all simultaneously throughout the clinic. So there's a lot going on campus when I was there, and I was on call every other day, 24 hours a day too. So I'd be responding to different types of medical issues, camps that were there. They had an Olympic gymnastics hopeful meet, I think it was, for 8 to 12-year-old kids that were trying to, I guess, get the attention of the Olympic teams, as one example of some other things happening. But it was really, just fast-paced, busy. Unfortunately, didn't have much time to go enjoy Colorado Springs like I wanted to, but that was okay, because I was busy learning and doing all kinds of cool things on these high-level Olympic athletes. They were all high-level, because sports medicine is only open to the top so many of each team. If you think of it this way, the USOC is kind of like the university and the governing body, and each individual team, like team boxing or USA gymnastics or USA swimming, they're governing bodies that are underneath the USOC, kind of like little colleges within the university. So they are subject to the USOC rules, and they actually pay dues. So in order for an athlete to see the sports medicine team that I was on, they needed to pay or have access to it, and only a certain level did. So that was something I didn't know beforehand either. So we were seeing the top of the top in all of those sports. Okay, so I thought it was important to inform you of the basic structure. I know it's a bit of a long video, but now knowing that, the next video I'm going to be talking specifically about something called medical cupping or vacuum therapy that became famous with Michael Phelps a few years ago. So the doctors and therapists that work with the USOC, think pretty highly of that particular therapy, and I learned it, and I'm starting to do it here in Brighton at DCG. So I want to talk about and show some demos about what that is, and if you may benefit from it with your chronic or acute problems, and just get the treatment that Olympic athletes get. It's pretty exciting. This is just the first topic that we'll talk about. There are other things that I'll be bringing here to elevate our clinic to the standards of the USOCs. So thanks for tuning in, and look forward to next week's video. Thank you very much.